Hello everyone, this is Dr. Hamad Haider Khan. Today we are going to discuss another case in the series of how to manage different cases in pregnancy. So today we are going to discuss a case of typhoid, how to manage typhoid in pregnancy. So I will not be going into details, the causes, what is a lot of details about the typhoid. So I will just going into management, a short, precise case. So tomorrow if you are going to have a typhoid case in your OPD or as a consultation, so you know how to manage such patient. So once again, a reminder that is a series on how to manage a pregnant lady cases as a GP, trainee, resident, and as an internal medicine specialist. So remember, these lectures are only for educational purposes. So let us start the case. So we have a pregnant lady. The pregnant lady comes to your office and uh, she's complaining of a headache, and she has a fever which is continuously increasing. It means it is a continuous pattern of fever as seen in typhoid. There's no fluctuation, not more than 1 degree centigrade. The patient has arthalgia, fatigue, diarrhea, and she has a loss of appetite. You can also have raw spots which are on the trunk, but that's not present in most of the cases. So let's suppose the patient, you do a physical examination, you find that its heart rate is 61 and its temperature is high. So it means the patient has relative bradycardia. So you order the lab, CBC, it shows hemoglobin anemic 10.1, WBC is being raised 15,000 and platelets are normal. So at the same time you have done a blood culture which came back to be a typhoid positive, because blood cultures takes time. So let us assume that the blood culture has been done and it shows a typhoid positive. So at the same case, you can have as a consultation, you can have a consultation regarding the same patient in wards. So now our question here is, how would you manage such patient? What medications you would give regarding managing the patient, a pregnant lady with typhoid? So we know the case is of typhoid, and it's a mild and moderate one. A severe one, as the patient will have nausea, vomiting. The patients might have fever, ongoing fever for many days. The patient might have restless, irritable. So once again, you have to know the pregnant lady. You have to know about the meds which are can safely used and which are contraindicated meds. So the two most important choices for us in treating typhoid in pregnant ladies is cefixime 400 mg OD for 7 days, or azithromycin 500 mg OD for 7 days. So you can treat choosing one of the medication, and then you can see the effect. There might be resistance going on to cefixime. You've been treating the patient for 7 days and then she's not getting well, you can put the patient azithromycin. But most likely people, we do the blood culture and sensitivity to know about the specific antibiotic to be given in pregnancy. So next, the patient have fever. So how would you manage a fever in pregnancy? So you can give safely paracetamol 3 times a day. If she has nausea and vomiting, you can give metoclopramide 10 mg 3 times a day, or tablet onset, that is on cetrons 4 mg BD or TS. If the patient has a gastric upset, you can give pantoprazole or PPI can be given safely. So this is just for the case of moderate to mild typhoid. How about a severe infection? So if you have a severe infection, the drug of choice in our setup, give ceftriaxone 2 gram IV once a day and diluted in 100 ml normal saline. And if the patient cannot take orally the medications, IV is being used, and you can use IV medications the same as for fever and for nausea and vomiting. Let's talk about the tests which are mostly valuable in the weeks. It is remembered by the mnemonic of BASU, B A and S and U. So it shows that every blood culture is the test of choice in the first week. Coming weeks you can so we're talking about the tests which can be positive. It can be positive in the coming weeks. The first week you can check for the blood culture with the mnemonic of BASU, as I told you. Then this PA, it is antigen viral test can be done. It's not mostly done now. Then is stool culture, and then is urine culture. But most likely you have to do a blood culture, but the gold standard test is bone marrow culture, which will show you the agent. So this was a short educational video about how to manage typhoid in pregnancy. I hope you like the content. It's quite precise to the point, because if you don't know a lot about typhoid management in pregnancy, so these are the drugs which you can safely use in the pregnant lady. Thank you for watching. Please like and subscribe my channel. Thank you.